Hello everyone, welcome to my presentation. Today I'll be doing an overview of record linkage and examples of probabilistic matching in public health. So I'll start off with an introduction to record linkage. Record linkage is a tool used to combine data from various sources that refer to the same individual or entity. You might also hear it called matching. It has its origins in public health, epidemiology, and survey statistics. And it's evolved a lot since then, thanks to evolution in algorithms and the ability of computers and softwares to process large data sets. So there are two types of record linkage. The first is deterministic, which requires records to match one-to-one, and it's more ideal for data with unique identifiers like SSN or Social Security number that is used in the US. Now, this type of record linkage might be overly conservative and lead to mistrue matches, especially when it comes to poor quality data. So for example, if between two records something is slightly off, those records will not be matched. Now, there's also probabilistic record linkage, which is the type that we're going to talk about today. It uses statistical methods to determine similarity scores for matches, and it addresses small mismatches when data is lacking unique identifiers like SSN. And it works by assigning greater weight to more reliable variables. Okay, so I'm going to talk today, like I said, more about probabilistic matching. Now, this kind of falls into two subsets. Deduplication, which is matching records within data sets. So if we have the same individual twice or more on one data set, you're matching those together, you're deduplicating. And then I have linkage, which is matching records between data sets. So if two individuals or entities are in two different data sets, you're linking those together. Now, it's impossible to say that two records match beyond any doubt. What this method does is weighs evidence for and against a match in order to quantify that doubt. The most modern and foundational probabilistic matching method was introduced by Linkage and Center in 1969, and that's what I'm going to talk about today. Okay, so the way that the Linkage and Center models set the foundation for modern applications of this method is by giving us these parameters called M and U that help quantify how strong a match is. M is equal to the probability of a match, given the records are a true match, and we call it an indicator of data quality. U is the probability of a match, given the records are not a true match, which is an indicator of coincidence. So what do I mean by indicator of data quality and coincidence? So for example, if the probability that given records are a true match, first name matches between records 90% of the time, M equals 0.9, which means that data quality isn't so good. It might not be being collected properly. And if amongst records that are not a true match, gender is a match 50% of the time, U equals 0.5, which means coincidentally, gender is matching amongst false matches half the time, which is also not a good indicator of data quality. Now, ideally, we would want U to be really low, meaning that the coincidence of records matching isn't happening too often, and M to be really high, which means the data is of good quality. Now, how do we use M and U? We use it as sort of a factor, so the ratio of M to U, and we calculate something for each field or variable called a disagreement weight and an agreement weight. And we would assign either the agreement weight, which is more positive or greater, or the disagreement weight, which is negative or lower, to a field, depending on whether records match on that field. And we decide that using software methods and pre-assigned thresholds. And then each of those weights is summed to calculate the final match weight for each pair of records. So to reiterate, if we have a pair of records and several fields or variables, such as birth date, gender, and first name, each of those fields will get assigned an agreement weight or a disagreement weight. You will add them up and you will get a final match weight. And I'll kind of visualize this on the next slide. Okay, so before I get to that, where did we get M and U? We get M and U from something called the expectation maximization algorithm. So the EM algorithm solves the following paradox. To estimate M and U, we need to know which records match. If you remember, those parameters M and U were conditional probabilities. But the whole problem at hand is trying to figure out which records match with record linkage. So something we can do is start by manually separating the true matches and the true non-matches. This might look something like training data that you all are familiar with. And we would observe agreement patterns amongst true matches and true non-matches to get our initial M and U. So in the expectation step, we use estimated model parameters M and U to predict matches. And in the maximization step, we would use the predictions to re-estimate the parameters. So we would repeat several iterations of these steps, and the M and U probabilities will become more and more accurate. Now we might start on parameters based on the assumption that variables like gender and birth date matching hold the same weight. However, we know that's not true because the coincidence of gender matching is a lot higher than the coincidence of birth date matching or even first name. So with more and more iterations, the algorithm will learn that birth date is a stronger evidence for a match than gender, and our parameters M and U will become more and more accurate. Okay, so here's an overview of how it works with that visualization. We start with the prior probability that any two records drawn at a random are a match. We'll calculate the match weight given the M and U parameters with the EM algorithm happening in the background. We'll compare those two records and increase the probability where they do match using the agreement weight, and decrease the probability where they do match using the disagreement weight, and those are what we call the partial match weights. Then we'll sum those partial match weights to calculate the final match weight. So you can kind of see on the visualization that the red blocks are where we've used the disagreement weight, and the green blocks are where we've used the agreement weight. And we would add those up to get a final match weight that quantify how similar two records are. And then usually at this point, researchers or statisticians will pick a threshold that classifies what a match is. Okay, so now I'm going to talk about some examples of probabilistic matching, specifically in public health. So probabilistic matching in public health can help us integrate data sources together, increase data sharing, and finally address novel research questions. The first case study I'm going to talk about is linking de-identified data for patients with traumatic brain injury in the US. So patients with traumatic brain injury are usually enrolled in something called TBIMS, or the Traumatic Brain Injury Model System, as well as state and national databases. However, to protect their health information, their data is often de-identified in both databases. What that means is that the people that manage these databases might take out their social security number, like I talked about before, or exact birth date and just keep their year or something. So what this does is create a gap in knowledge between clinical care, so when these patients were diagnosed or admitted, and rehabilitation. So what's going on in between? Are there any comorbidities? What do these patient outcomes look like? So what researchers did is they proposed a probabilistic matching algorithm to link patients between these two databases. And what it does is uses the Falakian-Sunter method to calculate parameters like M and U for variables such as hospital length of stay and gender. Now, an important method that we use within probabilistic matching is called blocking. So you can imagine if we have two very large databases, that's going to be a lot of comparisons that we're making if we're comparing each record on each database to each other. So blocking basically reduces the number of comparisons we're making by limiting who we're comparing to. So only patients with the same age, within the same sex category, and within the same year of injury were compared to each other. So 50% of the data was training data, and the other half was used to create the algorithm. So the training data actually did have an identifier called MRN, or medical record number, across data sets, and we used that to come up with our M and U, like I talked about before, and create and refine the algorithm that we eventually used for the rest of the data, and which can be used for future data. So the records from the study can be used to answer long-term questions, long-term outcomes that could help future patients in their recovery. And upon further research into this article, it looks like it's already been used to look at pneumonia outcomes in certain TBI patients in the US. Okay, so the second example I'm going to talk about is record linkage between HIV in a cancer registry in a city called Pune in India. So researchers in Pune are trying to determine whether the burden of cancer risk for patients living with HIV, or PLHIV, can be measured with limited unique identifiers. So the problem at hand is that increased longevity of people living with HIV, thanks to modern medicine in recent decades, requires a new understanding of potential comorbidities that might come up. The reason Pune was chosen is because it provides reliable access to antiretroviral therapy, and the city has a well-established cancer registry. After researchers confirmed that both databases were set up similarly for variables to be compared, they ran a probabilistic matching algorithm 4 times to ensure that all the matches were identified. And the outcome was that 32,000 patients from the HIV database were linked to 31,000 patients on the cancer database, so that there might have been some deduplication there, like we talked about in the beginning. Researchers were able to pinpoint statistical trends, such as mean age of diagnosis in certain cancers, and that people living with HIV might contribute to 2% of cancers in the general population. And from a public health standpoint, they were able to gather evidence that people living with HIV should receive priority testing for cervical cancer screening, as that's a cancer that shows up often, especially for women, which make up 40% of people living with HIV, as this sort of screening is not a routine test that's done in India, or at least not in this city. Okay, so some limitations of probabilistic record linkage that I identified while looking over these case studies were, the first had to do with calculating our parameter n, which is an indicator of data quality. So the TBIM study was only conducted using data from one center. However, values of m could vary from center to center due to different data entry methods. The second limitation had to do with blocking. So if blocking variables are miscoded, they could actually incorrectly exclude comparisons. So researchers realized in the TBIM study that this error wrongly excluded patients who didn't have ICD-9 codes, which is a sort of a medical code, indicating TBI in the trauma database. So they weren't even included in some of the blocking comparisons. And the last limitation is surveillance bias. So in the last study, stigma and poverty could lead to underestimation of certain cancers due to lack of access to diagnoses for people living with HIV. So this is obviously very specific to this case, but could apply in a lot of other case studies or diseases. Okay, and quickly, so in case anyone is interested in using record linkage, the software packages that are well researched in open source include FastLink, Record Linkage, RecLink2, and Splink in Python. These packages cover the key requirements that I talked about. They use Flaky Center, the EM algorithm. They have built-in blocking variables and string comparison methods. So if you're comparing two strings, such as names, and these packages also allow for custom comparator functions. So if you're trying to do a custom comparison with your own sort of thresholds that you want to specify. And here's some helpful sources if anybody wanted access to the case studies that I talked about today and the resources. Yeah, thank you so much for attending. If anybody has any questions for the next 2 minutes, I'd be glad to answer them.
There's a question in the Q&A.
All right.
The attendee says, very interesting presentation. Can you say something about consent to record linkage?
That's a great question. Record linkage kind of answers that question in such that it's linking de-identified data. However, I did also have that question, especially while reading the data about the HIV study, because that can be a very sensitive topic. So I'm sure that researchers do their best not to reveal de-identified data, but probably also take consent from the patients on both studies that their data can be linked. Thank you for your question.
And another question, are there demographics for which probabilistic matching may be less effective?
Yes, so when it comes to certain demographics, there can be selection bias. So for example, when I was talking about SSN in the US, if people, for example, are undocumented, they might not even have an SSN, so they wouldn't be included on certain databases to be compared. And that is definitely a limitation to record linkage. It's a great question.
All right, thank you so much.